Hi, I'm Dr. Richard Pineda, the chair of the Department of Communication at the University of Texas at El Paso. I've been asked by David Jerome, the president and CEO of the El Paso Chamber, to lead today's conversation, a conversation with one of our noted medical experts in El Paso, talking about business and health and how to deal with the pandemic that we find ourselves in. And so I'd like to introduce somebody who, in some ways, actually become the face of information the last several as it relates to COVID-19, an infectious medicine doctor, Dr. Ogechika Alozie. How are you today?
I'm doing good, Richard. How are you doing today?
I'm doing great. I'm doing great. So Dr. Alozie is your official title now.
I am presently the Chief Medical Officer at Del Sol Medical Center.
Fantastic. And with a number of years in infectious disease and infectious disease control. So, one of the first questions that I think members have and folks that'll be watching this video is, what should we be doing in terms of our expectations for where we're at with C-19? Are we close? At this point, we are recording in the first week of June. So at this point, are we close to reaching the peak? Do you think that we are over the peak? What should expectations be just in terms of how we deal with the virus at this point?
Yeah, I think a couple of things. Great question. So one of the things I've been saying sort of consistently for the last few weeks is that the conversation around peak is premature. That I think what we really need to understand is that we need to figure out how to live with C-19, COVID-19, SARS-CoV-2, whatever you'd like to call it. And then if we understand that we have to live with it, then we can learn how to plan for it and continue with it, right? I think that constant waiting for, is it the peak? Is it not the peak? Oh, the numbers went up, the numbers went down. Again, I always tell people 7-day average is what you really want to look at. However, interestingly enough, if you look at El Paso, a lot of the metrics that we look at analytically seem to show that we're getting a little better, right? And I think we got to pump the brakes to be completely excited about that because, again, there's a lot of variations in those numbers, but it's important to start to plan, if you haven't already been planning, for what comes next. How do you get to that 50% now that Governor Abbott has announced it? How do you keep your employees safe? How do you keep your customers safe? I think that's really the conversation to have.
In terms of your experience with infectious disease and particularly in the United States, we've never really seen an outbreak in this form like there have been in other regions of the world. What makes C-19 so problematic from your perspective as a doctor?
I think a couple of things. The fact that it spreads as easily as it does, the so-called R0, right? That transmissibility coefficient. If you look at some of the data around Wuhan, New York, Lombardy region in Italy, estimated that one person transmitted to 3 or 4 at a time. Right? And so that was that exponential growth curve that people were really worried about. I think outside of New York, majority of the rest of the country was blessed. And if you really look at some of our mortality data, whether it's 0.5% mortality, 1% mortality, or even higher, depending on where you were, again, a large proportion of those deaths and those transmissions seem to be in super spreader events, right? So choirs, or potentially restaurants, or meatpacking companies, right? Nursing homes. Unfortunately, nursing homes have predominantly driven a large percentage of the deaths that have come from coronavirus 19. I think the other thing is fear and concern, right? Initially, it was a conversation of, well, it only affects older people, as if to say, because it only affects older people, that those are disposable lives, right? It doesn't make a lot of sense. We should value all lives. That's what I swore an oath to do. But then the conversation that this can affect children, middle-aged, right? That's a lot of what that anxiety has come around. And we're at a point right now where, right or wrong, whatever we did as a response to the pandemic, once we found out February 21st, we had our first case in the United States, we're at a place economically where a lot of people have been harmed. We may have 20 to 25% unemployment, and the world that we know is expanding again. Right? And so people really are trying to understand, how do I expand safely? How can I move into this next phase of sort of globally living with coronavirus 19 and doing it safely?
In your experience, when you've looked at not only the patterns but the data as it comes together, do you think that there is, one of the often repeated claims is that it's like the flu in the way that people are getting it, or at early stages the mortality seem to be a lot lower, but to a certain extent we know that's not the case now. Do you foresee that as summer comes along, I mean, just people leaving home, engaging sort of in day to day, do you see the risk factors changing, or do you think that people, from your own sort of observations, that people have gotten pretty good about some of the protocols to stay safe?
I think it's a mixed bag, seriously. I think that we're all over the map in it. It all depends on where you are. If you're in the Northeast, New York, New Jersey, you're probably looking at this very differently than you're in El Paso. I think because of sort of the blessing that we have of our geographic isolation, we never had people coming directly from Europe or China, or wherever the case may be. I think sort of pivoting to the second question, which is what happens through the summer, we're going to have people continue to move. People are going to travel. People are going to get more and more comfortable depending on what the numbers show us. But I think the numbers are going to be where we really start to say, well, do we open up to the extent that schools are able to come back, right? Do we go from 50 to 75 to 100? There is some thought that that constant mixing, that constant interaction, as more and more people get the virus and spread the virus, understanding that a large proportion of these people are going to be asymptomatic or not have any symptoms, we may get to the fall and have another peak, right? Not just a coronavirus peak, but then again, we have to worry about what happens with influenza. The seasonal influenza that we constantly compare coronavirus disease to, what happens with that? Are we setting ourselves up potentially for a layering, right, or an augmentation of coronavirus effect on top of influenza? Not saying, I'm not a politician, right, but not saying that we're going to ever have to go back to shelter in place or shutting things down. And I don't even think that politically people will agree to do that, but we do need to be cognizant of it. I think a lot of the sort of shelter in place, despite the tremendous damage that it did to the economy, it's not an apples to apples conversation about, well, if we didn't do that, well, maybe we wouldn't have had all these lives. I mean, lives are lives. And because you aren't affected directly doesn't mean that you lessen them anymore, cheapens the death and loss of life. I think we really have gotten time, hopefully, especially in our local environment, to build up that supply chain of science, right? So we now have a medication, remdesivir, whether you're pro or con to it, that seems to reduce the days of symptoms in the hospital. We're now getting more things, like what's called convalescent serum, right? Being able to take blood from somebody that's recovered from coronavirus and give it to another sick person. A lot of clinical trial data pending on that, and so we'll see what happens. There's a host of vaccine, antibody treatments that are coming online. And so the longer you give science to catch up with things, and just as importantly, it's given local organizations the opportunity to stock up on their supply chain, right? So the PPE, which is critical in the hospital to avoid transmission within hospitals, we're able to build up on that and get comfortable with that.
So using your hospital as a sort of exemplar for a business, you have, as your sort of space indicates, some traditional office space, the sort of a close quarter situation. You've got some common space in terms of hallways and cafeterias, and then you've got open spaces around the hospital itself. How do you recommend, starting with the small space, like the offices, for somebody who runs a small or medium enterprise where you've got a series of offices or a series of rooms in one office? What are the high points or the things that are absolute must-dos in terms of creating a safe environment?
I think if you're really looking at a safe environment, so Atul Gawande had an article in the New Yorker about 3 or 4 weeks ago where he talked about a bundle. There's a package of 4 things, essentially. I think we have to always have personal responsibility for ourselves. How do you feel, right? Do you have a cough? Are you short of breath? Do you have a fever? If you have any of those things, you really need to sort of exclude yourself from the work environment. Right? I think that's number one. I think getting to work, then it becomes a bundle of other things. I'm looking around for the tools, right? Washing your hands, doesn't have to be hand sanitizer. Wash your hands 5 to 10 times a day consistently. Make it a habit. face masks. I mean, a lot of people have, again, they've turned, I feel as if we've turned science into a political volleyball all the time, right? But the data is really clear that, well, maybe it's not very clear. The data suggests that wearing a face mask reduces your risk of transmission. You wear the face mask to protect the other person. You're not protecting yourself from the other person. And so it's that mutual relationship between you and the other. If you're in a small space, even more important to wear those face masks, right? Even more important to have hand hygiene. And then when you can, social distance as much as possible, right? You've probably seen multiple places as you go around town that have retrofitted their environment so that they're spacing people out. Yeah, there's some data here and there around whether a cough can go a foot or 2 feet or 10, 12 feet, right? But again, I think it's fair if you do that very basic bundle of things, you can be safe. I think specifically around hospitals, I truly believe that apart from your own home, the hospital is probably the safest place that you can be. And it's because we've done all of these things, right? We're temperature checking people when they come in the door. We're asking them about their symptoms. We have mandatory and universal masking. Everybody's washing their hands constantly. And where we can, we social distance. And so again, I think those are the keys around that. Going to the sort of normal workplace, again, I don't expect that there's going to be one singular answer for everybody. And I also think it's a false narrative if we sort of push one answer on people. Again, I think that bundle of safety is the key. You're able to hopefully not pick and choose, but try to get that bundle as close as possible and then kind of go from there.
In what you've seen so far, either in El Paso or even what you're talking to your colleagues about in other parts of the country, are there practices that people have sort of taken off on that have no effect and maybe could make the situation worse? I've been reading a little bit about places that have asked patrons not to wear rubber gloves in because the sense is that people are wearing those gloves consistently and they're not actually taking them off after every individual encounter. So in fact, what they may be doing, even if they are encountering the virus, is then moving that virus to other places. Are there practices like that you, maybe not that you worry about, but that you would say, hey, listen, you think that's a good idea, but that's just not a good idea?
Yeah, I think that's a great example. I think, again, I really rely on hospital practice, right? So basic standard infectious disease or infectious prevention practices. And in a hospital, a nurse, physician, whomever would never wear gloves from one patient to the next patient, right? That's an infectious disease risk. That's a transmission risk. And so we would expect that people would not do the same thing, right? And so it doesn't really make sense if people are going down that road. I think there are a host of urban legends and myths and other things that are out there where we really want people to sort of really focus on the core, right? And, KISS, right? Keep it simple, stupid. You can't really make this a lot more complicated. People talk about testing and antibody and PCR. Again, the reality is that supply chain is not going to allow us to test all 800,000 people that live in El Paso. And even if we did, 72 hours later, they could get infected. So that's not a rational strategy for long-term continuance or long-term mitigation, right? And so again, I really do strongly believe that as people try to protect themselves, protect their families, protect their investments around business, it has to be around those bundles. Now I understand, and I mean, I have gone to a place to eat for work, and you understand that you have to take off the mask to eat, right? But again, the tables are separated. You hope that the person that you have come with, I mean, you have that compact between the two of you. You work together, same household, whatever the case may be, you've reduced that risk. And I think that's really where we are. There's not going to be a perfect solution. I think it's important for people to understand, just like in the beginning of this pandemic, when people came on TV and said, we need to understand that fear and anxiety are understandable, but they're not going to help us get through this, right? And so we've sort of gone through those stages of grief, the denial, anger, grieving, bargaining. Maybe we're getting towards that acceptance, right? Are you bargaining? What are the risks? What are the risks of traveling? What are the risks of staying home? I tell people, and I used to do a lot of consulting and public speaking nationally, and they're calling me to come back. And I say, you're absolutely right. My absolute risk of getting on a plane is probably small, right? 1 in 10,000, 1 in 100,000. But my relative risk to staying at home in El Paso is multipliers high, right? And so those are the bargains that we have to make with ourselves. Is what we're going to do worth it, right? Is the, whatever it is, I mean, whatever the du jour thing that people want to do, is it worth it to just be a little bit safer? Everybody has their own individual decision they have to make around that.
So one of the things that I think for business owners in particular, not only for their employees, but also for their customers or their patrons, depending on the system. In the hospital, you have a lot of repetitive behaviors that you train your entire team about. So you've positioned bottles of disinfectant outside of rooms, and that was done way before C-19. You've posted instructions around different parts of the hospital for the way the protocols that people would use. Business owners may not have been in a circumstance where they need to teach kind of a behavioral change. Based on your experience, do you have any insight into how you do that? I mean, it's easy to sort of say, okay, everyone's going to do this, but even in those environments, people get a little bit lax, or they just this time they forget, or maybe they're rushing, or so are there things that you would instruct somebody to say, listen, this is the way that you get, somebody to engage in a healthful practice that they're going to do consistently?
I think you bring up a great point. I will say this, right? In as much as hospitals and healthcare facilities like to talk about the great hand washing and all the rest, even we struggle with it, right? With those repetitive actions across the board in healthcare, we don't always do the greatest job. I will say that coronavirus has helped healthcare across the board get people to hand washing levels that they weren't at before. Right. So that added sort of angst or fear, worry about what they could catch has driven that. I think you're 100% right, though, around organizations have to train their teams how to do things repetitively. And don't make it punitive. If you make it punitive, it falls apart, right? Human nature doesn't like punitive tactics. And so understanding that if you're in a restaurant, you used to clean off the table anyway, just do it differently. Right? Stagger the cleaning, stagger the table seating arrangements, right? Ensure that you have the proper cleaning supplies and you take a little more diligence and then teach to it, right? Teach to that so it becomes repetitive. You have to explain to people, why is this task important for us? Why is it important for our customer? And so I think if you do those, and that's why I truly believe, Richard, that it's important not to make these things complicated. Because if it becomes a complicated task list, you can't remember it. And when you become under stress or you're speeding up to get to the next customer or to the next task, that's when those things fall apart. And so a basic bundle, simplify it, and then teach the repetition of it, I think that really becomes the key.
There was a mad dash as the pandemic started, and I think there's some ebbs and flows on this for people to purchase PPE for themselves, for their employees, for their customers. Then almost simultaneously, there was a question of whether or not some of that PPE was legitimate, or if it was repackaged, if it was just somebody slapping labels on stuff. Are there any guidelines or any things that you might suggest as business owners are thinking about maybe stocking PPE for their employees or for their customers? Are there things they should look for? They're short of asking you where to go, but what is it that a responsible business person should be looking for when it comes to purchasing PPE?
I truly believe that in terms of PPE, again, it's that KISS mentality. A surgical mask for the purposes of engagement in the community, whether it's at a business, restaurant, wherever the case may be, or in some places, even a normal cloth mask, should be able to provide adequate protection, assuming both parties are wearing a mask, right? Because again, remember, mask protects not you, mask protects the other person. It's a bilateral compact, right? You protect me, I protect you. And so I think, obviously, there are people that are going to do what they want, finances, but if you really want to ensure that your supply chain is robust, the simpler you keep it, the better. If you're going after a KN95 or an N95, you get into the problems of, well, what if you can't afford it after the first 100? What if the supply chain breaks down? Remember, 80-ish% of PPE in America is made in China, right? Or is made in Asia, in India, wherever the case may be. And we're not the only country that's trying to get that product, right? This is not like a Katrina where the whole world in the United States can focus in on Louisiana. This is, the whole world is Katrina. and everybody's trying their best to get these things. And that's why you see sort of maker spaces coming up with 3D printed, whatever it may be, right? I mean, shout out to Fab Labs for doing an amazing job throughout this whole thing. And so again, I really do encourage business leaders to try to keep it simple, ensure that your people, the people that you're trying to protect, that they have masks. Hopefully you have some sort of policy about people coming into your space, that you're ensuring that you're doing cleaning where need be, that you try to space out, maybe staggered shifts, depending on the kind of work that's being done. But when people get too caught up in on, I need an N95 or I need a KN95, I think that defeats the purpose. And the truth is this, that supply chain may exist right now, but if we do get a so-called surge or a fall revisitation, right, of this again, the hospitals are going to have priority for those kind of PPE, right? And so not only are you complicating the supply chain, but you're also making it harder for the hospitals to get that. And then you're supplying. I think it's just like a marathon or any race. If you're working out, you want to start so that you can finish. You don't want to mad dash for the first 2 or 3 weeks of 75%, and then we get to the end of June and July and you have no PPE, right? That doesn't do anybody any good. And so I think, again, I really do believe that the simpler you keep your bundles, the better for everybody across the board.
That's great. One last question for you, and I think this has been one of the things, as I said at the start of this, I mean, you've been on television quite a bit, and I think it's been very reassuring for a lot of folks in the community. But information, I think, is still one of those landmines when it comes to conversations about C-19, not only where it's at, as we talked about at the beginning, but also even how you deal with it or how you strategize. To sum up, what are the places that you go to in terms of ready information that you feel comfortable in saying they know what's going on, or they can give you pretty good insight into what's happening? Who are the information leaders in that particular space?
Yeah, I think there's a bunch of them. It's interesting. So, I mean, I have a bunch of social media channels, and Twitter was something that I kind of used, but I never really was good at. Just didn't have the time to tweet and a host of other things. Twitter has been amazing during these quote unquote times of COVID for information. The amount of information out there is changing on a minute to minute, hour to hour, day to day basis. And so there's a host of sort of authors on Twitter, from Andy Slavitt, who used to be Obama's CMS administrator, to Scott Gottlieb, who was the FDA boss under President Trump, Paul Sachs out of the Brigham. There's a COVID review that's done daily. There's a host of people that I sort of follow and really kind of disseminate information. CIDRAP, Dr. Mike Osterholm, who I worked with when I was in Minnesota, great mentor. And so watching their Twitter feeds and seeing how the data comes out, the information comes out. I think being a voracious reader to begin with, right? Just sitting there and reading article after article and disseminating it and trying to understand, getting on various webinars, conference calls. And I think this has been, it's a weird, funny time for me, right? I mean, you know, where I was before in my background, but being in this space right now in the time of COVID, it's kind of been a blessing and a curse all at the same time. But I think one of the things, there's a recent poll either by Reuters or maybe it was the New York Times about information, where people trust their information and where they don't trust their information. And what was really clear is that people trust information from their physicians and healthcare systems, right? And so I think it's important for us in the healthcare space and partners like you and the chamber to disseminate this information as much as possible, because if not, in a vacuum, people go and find anything, right? And that anything, unfortunately, can oftentimes be poor or bad information. And so I think it's very important that we continue to do these, whether, I mean, there are multiple people in the community, myself, Dr. Burgos does one, weekly Q&A, there's a host of other persons across the community, but find your trusted source and lean on them to really disseminate that information to you, find those trusted partners.
Fantastic. Well, this has really been an enlightening conversation, and the Chamber is pleased not only to have your voice guide businesses, but also just to have your voice in town. We're very, very lucky to have you. Thanks so much for your time, and for the folks that are watching our series, thank you as well.
All right. Have a good one. Thank you so much. I appreciate it.